Disha, we are so glad you're here. This is our clinical roundtable where we get together and we share insights and stories, and we try to help each other practice our very best in our profession. And it was so great before we kicked off. We talked about how, I had met you over at ADC, Annual Dialysis Conference, and your story was so moving. There are a lot of folks that end up coming to kidney disease in their youth, and it's so hard. We were talking earlier, as clinicians, it's very helpful for us to always stay in touch with a personal aspect of our work. Just like we were talking about earlier, the machine of healthcare can kind of beat the caring right out of a clinician. And it's paramount if we're going to really bring our best to help other people live their best lives, and ourselves for that matter. Leading with care and authenticity is really, really important. That's how we help people change their lives. So we're really grateful to you for sharing some time with us. I know you're up and coming clinician yourself, studying. Let's see, you're at Berkeley, correct? Is that where you're studying? At Berkeley?
No, it's UCLA.
UCLA. Oh, how dare I say Berkeley? Oh, at UCLA. Well, gosh, I'm just glad you're here. Tell us a little bit about you and your story and your kidney journey and your message.
Yeah, of course. So hi, everyone. My name is Disha Yadav, and I'm a third-year undergraduate student at UCLA. And I'm studying psychobiology with the hopes of attending med school and becoming a nephrologist one day. So that is the goal. But today I'm obviously here, not as a student, but as a patient. Someone who has spent over a decade navigating the healthcare system, learning to live with a chronic illness, and kind of understanding what it truly means to feel seen or empowered, not just by myself, but mainly by the professionals that are meant to kind of take care of you in that kind of situation. So I'll just jump right into my story, not really beat around the bush, get right into it. So at 11 years old, I was diagnosed with lupus nephritis. I didn't know what the word nephritis meant at the time, but I quickly learned that it was something that was going to change everything for me, my body, my childhood, my family's routines, and kind of the entire trajectory of my life. I just mentioned that I wanted to be a doctor, but prior to being diagnosed, prior to everything, I actually wanted to pursue a career in law. That's where most of my, expertise per se at the time, as an 11-year-old, whatever expertise you can have as an 11-year-old, really resonated with me. I was really into debate, into speaking, public speaking. So it's, something that changed the entire course of how I kind of wanted to make my life move forward. So by the end of this talk, my hope is kind of that you'll walk away with not only a better understanding of what patients go through, but with a sense of how powerful your role as a provider truly is in shaping, a patient's resilience, trust, and hope through the entire process. But yeah, like I mentioned, prior to being diagnosed, there were a lot of challenges that were kind of seen that I saw in terms of my own body, in terms of what my mom saw, things like that. I went to a private school, and there is a very rigorous course. Everything is very academically inclined, very difficult at times. But there were some things that were very obvious that you could tell that I was going through something. My literature, history, and science teacher all noticed. They actually asked me if I was having any issues at home or something like that, when in reality, it was my body just fully not functioning. I was falling asleep in the middle of class. I was unable to get up from the desk that I was sitting at, and I actually needed physical assistance during the time too. And it was very confusing because they were like, they didn't know what was happening. I didn't know what was happening. And I was also not a vocal child. I wasn't someone that would really explain things to others. My PE teacher had made a couple comments that really felt insensitive during the time, looking back at it, but I just thought that it was him being very strict on, that was the environment that the private school had. But he was making a lot of comments like, oh, you're running from like your 8-minute mile that you're supposed to be running to like a 12, 13-minute mile now. It was a very competitive school, if that wasn't clear. But yeah, it was, I physically couldn't walk. I physically couldn't do things. Every exercise was just not possible for me. And I didn't know what was going on. And I didn't voice those opinions either, because my family and we were close, but not close enough to where I felt like I could express all of this that was going on. But the reason my
Well,
mom...
you surely you didn't know what was going on, right?
Exactly. I had no idea. I had no idea what was happening. I had no idea how to approach it, whatever it was. But my mom did realize eventually that something was happening, because, if your daughter who eats anything that you put in front of her, vegetables, whatever it is, whatever food that you make, zero complaints, starts not eating, just completely stops eating. Like I was told as a kid too, like many parents, like our family friends would come up to me and be like, oh, we're so proud of you. We're so glad that you're like, you eat everything that you put in front of you. Like my friends, whatever, they'd like only eat yogurt and rice. Like that's it. They were so selective with what they would eat. I would eat anything and every food that you asked me to eat. I had no complaints. And so, when that kid just stops eating all of a sudden, you realize that something's wrong. My mom even tried bringing me my favorite food. She'd bring Taco Bell all the time. And I would just eat it, throw it up immediately. So she realized that something was happening. We went to the doctors. They misdiagnosed me with, I can't even recall, it was some random illness that they said, oh yeah, teenagers just have that. Which was so confusing to my parents, because they were like, this doesn't seem like a normal behavior. I didn't go through this when I was a kid. She's going through something. My clothes weren't fitting. I was gaining so much weight, which made no sense when I wasn't eating anything. So eventually obviously found out that it was the water retention. It was hard because I was skipping, like I was falling asleep in classes. I wasn't performing well on tests. I wasn't doing anything, but I didn't know what was happening. I just thought I was lazy. I just thought somehow I'd become very lazy overall, whatever it was. I used to play competitive soccer. So, going from that to someone that couldn't even move was so, so beyond difficult. It was just a whole change, and we didn't really understand it. But eventually, the diagnosis happened because I went to, my parents took me to the hospital again and again, and my mom kept trying to feed me foods that I really liked, and nothing was happening. So we went to the hospital, and there was a lump on my vagina that they had misdiagnosed with some other illness. And then I went to the hospital, and they asked me to pee in a cup, and I wasn't able to. I was sitting there, I was just unable to. So they were like, you should drink some more water. So I'm sitting there drinking water, nothing's working. But then eventually I did end up peeing a little bit. They used that. Honestly, I couldn't tell you what happened next. I think I blurred out that entire memory, because all I remember is somehow being put in an ambulance and then being taken to the ICU. I remember waking up with a catheter in my leg. I don't remember what happened prior, what happened during, all of that, the transit. Like asking my mom about it feels like a sore memory, so I don't like to bring it up for her. It's probably very difficult for her to even discuss it. And I know for a fact that my mom's more open about talking about things. Yeah, than my dad is. Like he refuses to even discuss anything that happened, which is absolutely valid. And whatever he's been through, watching me go through it. But I couldn't ask, and I don't know what happened during that time. But just waking up in the ICU with a catheter in my leg at 11 years old just is shocking. Like I don't even know what a catheter is. So to see that in my thigh is just, so it was so confusing. I didn't know what was going on, and it was a very difficult.
A catheter, was that not a urinary catheter, right? That was a vascular catheter. They went in through your groin. Oh,
yeah, it was a vascular catheter. Yeah, it was just like I fully didn't understand what was happening. They showed me a video on dialysis. I was like, this makes no sense. I don't want to watch it. I don't know what's going on. But yeah, that was what was happening. I was getting dialysis done. A lot of issues ended up happening at the hospital as well. The care was not good. I was being explained things. My mom was being treated very poorly. A lot of like malpractice issues may have happened as well. Like in the way that they were treating me, didn't enjoy the way that I was being treated at the hospital. And that's so important, especially as an 11-year-old, for someone that young to have to just sit there and listen to all of this stuff going on, and not being respected by the nurses or the doctors is really hard to see, because I don't even know what's going on. And
doing things to you and not explaining what's going on, helping you come to grips with something that just totally changed your life and your family's life, everything about your life, and you're just along for the ride.
Exactly. So like, they're feeding me these medications, they're putting a bunch of IVs in, but I don't know what's happening. I'm not being told what's happened. They're just doing it, and they're like, trust me. Basically what they're saying is, trust me, but we're not going to tell you anything. And you can't really trust anyone without getting any information, or whatever it is. I don't expect you to tell me your entire life story so that I can trust you, but I do expect you to tell me what you're doing to me, because it's my body. And if I don't know what's happening, I'm going to struggle. I am going to struggle. And it was really very hard to kind of go through all of that. I spent 50 days in the hospital. There was a lot of issues that ended up arising, and I think a lot of it came from me not being educated, and my parents not being educated, because we weren't sure what was happening, so we just let it happen. I spent my 12th birthday, Thanksgiving, Christmas, and New Year's in the hospital that year. And it was a very, very difficult time, having to somehow be put on a renal diet, not understanding what a renal diet was, not understanding how my kidneys came to fail, just understanding that something was happening to me, and I was just wondering why. The entire time was just, why is this happening? I have no idea why it's happening, so I'm just confused. And it was a very difficult time to kind of deal with all of that. And, especially someone that was about to get into middle school and get into, like, I was in middle school, I was going to high school soon, having to kind of deal with all of that. So I discharged and on hemodialysis for about, I believe, 6 months before I was taken off dialysis, because they told me I had gotten better. They said that there was, my creatinine had decreased to about 2. And so they took me off dialysis, and the catheter was removed. And then literally 3 months later, I had to go back on dialysis. So, there's also that frustration from my parents and me, like, if, I'm glad that there was improvement, but was it enough to take me off dialysis? Because now I have to go back on. The second time around, obviously, we ended up choosing peritoneal dialysis, because I was going to high school and I wanted the chance to, be able to talk to everyone, make friends, have a good time, enjoy my teenage years per se. But that in itself was so difficult, because being on dialysis is not easy. I used to describe it as torture. Like, I still describe it as torture. Yeah. It's a very difficult procedure. And, having to wake up every morning feeling like absolute garbage is just terrible. It's really, truly terrible. I didn't sleep most nights. I couldn't, the drain cycle, whatever it was constantly painful. They had to change the program because of how difficult it was for me. I thank my mom every day, because she would stay up with me all night while I was not able to sleep. And it was great to have that support system with me. Like, I didn't expect her to stay up. I didn't ask her to stay up. She just would, and she wouldn't fall asleep until I fell asleep. And I know she had things to do. She had my sister to take care of at the same time. She had a lot going on in her life as well. She actually ended up quitting her jobs just so she could take care of me. And I know how important her career is to her. So for her to make that decision was I can't thank her enough for everything that she's done for me. And I don't know how to thank her for that. I truly can't, for everything that she's done.
I can tell you, we got a lot of mamas on the phone. How many mamas would lay down their life for their kids? You wouldn't even have to ask. And I once heard a thing I loved, and it said, a parent's greatest joy is in the successful and joyous living of their children. So you live large, that'll make everything your mama did really beautiful.
Yeah, I mean, I live every day hoping that I make her proud, that I'm there, she's happy with what I'm doing for my life, and she's happy with everything that how I've grown from where I came from. But which honestly is why it hurts so much. Like, I did mention this when you heard me talk as well, that It was so difficult to see her perspective on everything while I was in the hospital, while I was getting treatments, whatever it is, just be completely dismissed. Because as much as I can say I know myself, she knows me better. She knows me far better than like I know myself. I might not express. I wasn't very like verbal. Like I didn't want to talk about everything that I was going through. I just wanted to pretend that everything was fine. I was nauseous on a daily basis. I was struggling with the disease. I didn't want to come to terms with it. It was so hard. I wanted to pretend it wasn't happening. So when the doctor would ask me if things were okay, I'd say, yeah, everything's fine.
It's good. And then they would dismiss your mother, right? Your mother would speak up for you and they would dismiss her.
Yeah, they were like, she's a teenager. She can talk for herself. She needs to learn to advocate for herself. But I'm still a kid. I'm 13 years old at this point, 14 years old. I know things are happening, but again, I am a teenager. I don't want to talk about these things. I want to pretend everything's fine. I can go to school, hang out with my friends. Everything's good. And my mom's there.
I want to be just like my friends and have a life. Yeah, absolutely.
Exactly. I wanted to have that normal per se lifestyle, be like, okay, everything's okay. I can just go hang out with everyone, do everything just fine. But no, I have a catheter in my stomach. I'm walking around barely able to walk these days, struggling every single day. And the person that knows that best is my mom. And they just, every caregiver in certain aspects would dismiss her opinion because they wanted me to speak. And I understand that. And I would speak eventually. But during the time when I was struggling with my illness, she was the one that knew me best. And you can't fix my care and help me if you're not listening to my mom's perspective. She was the one staying up all night with me, knowing what I was going through during those drains, during those cycles, whatever it was. She knows it best. And she was by far the biggest like supporter doing all of this. And I hate to see her opinion being dismissed. And it's why like I advocate so much for taking care of the caregiver as well, or respecting the caregiver.
Yes.
Yeah.
You know, that's interesting that you talk about that, because sometimes, you know, we work with family members as well. And we talk about how, you know, honoring sometimes their gatekeeping and sometimes they're, it's really important to make sure that everybody in that family who's involved in the care is involved. Is really, really impactful. And there's a very compassionate and a compassionate way to do that to benefit the member. But Caroline, did you have a question for Disha? Or were you just raising your hand for the mama? She might just be raising her hand for the mama. Anyway. Okay.
Yeah, no, it's just a lot of the time it hurts to see that someone that's so important in my life and someone that's really shown me so much respect in terms of everything is really being dismissed in this manner. I will say that I've had amazing nurses. My PD nurses by far were immaculate. I have nothing, no bad words, no negativity. They had so much support for me through everything. They probably know me best. The doctors don't know me as well as my PD nurses do. I would tell them everything because I felt comfortable telling them everything. But with like my doctors, it was really hard because it felt like they were just dismissing my perspective and my mom's perspective a lot of the time. And it's difficult because you don't want to see that from your doctors, from someone that's supposed to care for you. I will say I had one absolutely amazing doctor that I will forever remember. She's amazing. She gave me so much, and she actually helped me with my college applications, things like that too. And then I actually, had another doctor who really supported me through the transplant process. And he is by far someone that I look up to so much. My mom told him that one time and I was really embarrassed. I got like upset with her. I was like, why did you tell him that? But he knew me best, and he actually understood my concerns, things like that. And, after my entire PD journey, even though it was a really difficult process, when the transplant finally came, everyone around me was thrilled. My parents were like ecstatic, but I was terrified. Dialysis had kind of become my routine, my normal. And so like the idea of change kind of felt more unsettling than exciting, because I remember sitting there like nodding along with the happy conversations. But silently I was like, no thanks, I don't want this. It's like another complete change. And, I knew a transplant would benefit me. I'd be happy with it. But with all of the things that would come with it, all of the changes that would come with it, I was so accustomed to the dialysis lifestyle. I didn't want to change it at the time. I was scared because it had just become my normal. And I was like, okay, I'm used to it at this point. Let's not bring any more change into my life because it's already been a struggle the past 6 years. So, it was something that I really remember because I remember my doctor, he had also called to talk to me because I'm sure he knew I voiced my concerns to him because I felt really comfortable with him. He was someone that actually listened to me and understood where I was going. He always used to relate to me because he knew I was a very academically inclined person. I was someone that really cared about my academics. And so he would tell me a lot about how the college process works, how applying to colleges works, things like that. And when the transplant came around, I was actually in the midst of applying to colleges. So he called me and with the sole intention of talking to me about academics. He called me and asked me how my college process was going, how the essay writing process was going, if I needed any help, things like that. And that's when he really slowly brought into the conversation the idea of me getting a transplant or the transplant that was coming up. And it was nice to hear that he was really trying to relate to me in an aspect that I could kind of relate to. And he made me feel comfortable. And that's when I opened up about my concerns about how I didn't want the change to happen. And he really helped me figure out a way to kind of channel that energy into a positive light so that I would go into the transplant with a positive outlook and come out of it with a positive outlook. He was also the one that performed the surgery. So it was really nice because I felt comfortable knowing that he was the one that performed it, someone that I trusted so much. Exactly. Exactly. Yeah, I'm sure any other surgeon would have done an amazing job, but he cared, so it really mattered.
Yeah, I think there's something there. When you feel like people care about you as a person first, that rapport building is so important. Yeah, that's really incredible that you shared a little bit about that.
It's amazing. He actually is very adamant. Apparently, I've learned that he really wants to follow up with the patient throughout. He's really excited to know how the patient's doing too. And that's a doctor. In my eyes, that's a doctor. It's someone that, even post-surgery, even post the transplant, still following up, asking how you're doing.
Yep.
But yeah. Oh, can you hear me?
There you go. I got you back. Yeah. So he continued to follow up with you and show concern and care over even after the procedure. Yeah.
Right. Yeah. He was very dedicated to making sure that my care was amazing. And I really thank him for that because I think it's one of the only things that got me through the transplant. And knowing that my doctor really cared about me and wasn't just doing this, because it was his job. It's because he genuinely is passionate about what he does. And I think that's something that really, resonates because, it's as a patient, I want to feel that I'm being taken care of properly. I'm already going through such a difficult time in my life. It's so hard. And I get it that, patients act out, patients have issues that come with their care. But I think that sometimes it's not recognized that they're going through a lot. And it's obviously, their level to how much they can take it. But it's still a very difficult thing to go through. And kind of understanding that we need to kind of respect their opinions and respect what they're going through is really important. And that makes the patient also recover faster. And having a good mental health and good mental state while going through everything is really important because it helps in your recovery process. If you're constantly stressed, your body's going to be in stress. It's going to cause more issues. If you're happy or going through the process with a positive mindset, you're going to come out better than you would if you were there in a negative mindset. Obviously, doctors, nurses can't guarantee outcomes, but they can support the journey in a positive way that makes it easier for the patient while they're going through it. And obviously, recovery was not a linear process for me. There were obviously highs and lows. I had to adjust not just physically, but mentally to a new body, a new routine, and I guess a new definition of normal. But I did find clarity. I realized that my experience wasn't something that I had to simply leave behind. It was something that I could carry forward. I kind of began seeing how I could use my story to advocate, educate, and eventually care for others the way I wish I had been cared for at times. I have had nurses, like I said, my PD nurses are amazing. I love seeing them whenever I get the chance. I actually saw one of them at the conference, and it was so amazing to see her face. Like, I lit up immediately. And then the doctors, like the doctor that was there for me, whenever I see him, whenever I come in and I get the chance to see him, it's just amazing because it's so invigorating, like just knowing that there are people that really care about you. And that's really what led me to med school as well, or like wanting to go to med school, because I want to make sure that, as someone that's gone through so much, every doctor knows that it's really important to be there. Every nurse knows that it's really important to be there for the patient, not just in a professional setting, but also in a personal setting, to make sure that they know that you're taking care of them and you really care about them as a person. Obviously, like, this doesn't mean that you have to share your entire life story with them. It just means that you're listening to them, and they're the ones going through what they're going through.
And regardless, to your point earlier, regardless of how they're acting at the moment, it's really important as nurses and clinicians that we can look past some behaviors that sometimes we hear about in a dialysis setting. There's a lot that people have to be angry about. Their lives have been stolen. And to your point, dialysis, while life-saving, it's still torturous. It changes everything about your life. People have a right, and there's a benefit to some of that anger. That's what gives people power, to help them, give them energy that they need to do the work of survival and healing and growth and repair. And so, as clinicians, not being afraid to lean into the dark side. Sometimes it's not comfortable to sit with somebody who's in that position, or somebody who's angry, or somebody who is crying, or who is grieving, or who is feeling lost and bewildered. But as clinicians, that's part of the holy part of our calling, is that we are not afraid to go to those dark places with people and be there with them. Dark places are never quite as dark when you've got somebody, by your side.
Yeah, I agree wholeheartedly. I will say that I know at times I haven't been the best patient per se. I've been disrespectful to some of my nurses when I was in the ICU, or I would have a lot of tantrums that would pop up. Like, it was more just like coming with the illness. Like, it was such a difficult time. And I understand that, it's really hard for nurses to go through all of that too. Like, they're also people. So having to deal with all of that is really, really hard. And it takes a toll on your mental health, on you as a person as well. But I think one thing that needs to be acknowledged is that none of it is coming from a place of anger or hatred. None of these patients are out there trying to hurt you. It's just they're going through so much that they need an outlet. And sadly,
they're trying to survive.
Yeah, whatever it is, like, in that moment, you're there, and it ends up, you end up being that outlet that they take it out on. But as long as you just know that it's not personal, it's more just they're trying their best and they're trying to deal with everything. That's really important. But that's just something that I think is so key, especially in this process, that a lot of people forget sometimes.
They do.
I know it's hard to remember when you're being yelled at or being, attacked sometimes, whatever it is. It's really difficult to remember that. But it's something that needs to be acknowledged regardless. And obviously there's a limit to what a patient can and can't do in terms of their behavior. But it's important to remember that none of it is coming from a place of they want to hurt you. Just they're trying their best.
Absolutely. Absolutely. I love that you brought that up. I was reminded recently of how important that is sometimes people who are in these very life-altering situations, how scary that is. And I've seen people denied care because of their behavior, and I tell you, that will piss me off. It's not their job to behave nicely. It's their job to try to get through that situation. It's our job to help them navigate that. And there's a difference. There's a real difference, to your point. They're not trying to be, they need somebody in their corner. They're backed up in the corner, and they don't feel like they have anybody by their side, nobody to fight that battle with them or for them.
Right. Exactly.
So yeah, thank you for bringing that up.
Yeah, of course, of course. I mean, I'm glad, I'm glad I got the chance to talk to you and explain all of this. It's just really important sometimes. And I guess I have a couple of like key takeaways that I kind of wanted to share, mainly just, one, the caregivers really matter. It's just that's something that's really important to me personally. And I know, working with a lot of doctors right now while I'm on my path to med school, I try to remind them sometimes too, is really just never disregard the role of a parent, a sibling, a friend, whoever it is that's, advocating alongside the patient. In my case, it was my mom. She wasn't just like my support system. She was my voice when I didn't know how to use mine yet. So that's just really important to remember. And like also, empowerment doesn't always look like independence. I think that's also something that people really forget. Don't just assume that because I'm a teenager or a young adult that I'm ready to take on everything by myself. Empowerment also just means supporting the patient's support system. And that's something that is really key as well, kind of going alongside what I said earlier about my mom's situation and everything there. Like, she's seen me through my worst. There's no way you're not going to listen to her. Like, she knows me better than I know myself, and I know that. Like, as much as I could say, like, oh, you don't know me at all, whatever it is, she knows everything. But and like, third, just help us as patients navigate these treatment options with kind of honesty and sensitivity. It's not just about handing us the facts. It's kind of about meeting us where we are emotionally and walking with us, not like ahead of us, just being there while we make sense of our options. And don't just throw a bunch of facts in my face and expect me to understand and be like, okay, yeah, that makes sense.
Or a handout or a video or whatever.
Exactly. Like, if I want a better understanding, just be there, because you have had the training, you've gone through the education, whatever it is. I haven't. I'm a patient and I don't know what's happening. And I'm trying my hardest to come to terms with it while going through it actively. So being there for that process is really important. And lastly, just, we as patients, we're more than just our lab results per se. We're people with goals, fears, humor, dreams, whatever it is. And this is a step back in our process. For us in our minds, it's a step back. So sometimes, the most empowering thing like a provider can do is acknowledge us as whole human beings, especially in moments where we really feel fragmented, like feel like our life is being torn apart. So it's really nice to see when, my doctors, my nurses take an effort or take an initiative to want to know me rather than just, oh, okay, your creatinine, sorry, looks a little low today. Let's get you back up, whatever it is. Your potassium's too high today. Like, I know that. I'm working on it. We can talk about that later. But you know what else is great? Like, this is what's happening in my life right now, and I'm really excited about it. This is like, I'm super happy about whatever it is. Like, it's just nice to hear when doctors and nurses take an initiative to kind of understand me more as a person rather than just, whatever my lab results are.
So you're more than a pair of walking kidneys.
Exactly.
Yep.
Like, I know that's what I'm here for, but yeah.
Well, it's interesting that you say that, because sometimes, what can happen when we're going through a challenge like that, especially if it's a health challenge, we lose who we are. Now we become a cancer, or we become dialysis, or I become heart disease, or I become whatever it is. And that's not who we are. That's what we're experiencing. That's not who we are. And so, but, I did want to open it up for the nurses to see, this is your chance, have an insider view, so to speak. And what questions would you have for Disha?
Hi. Well, first of all, I am so proud of you. You're amazing. You're so strong, and you really, I'm kudos to your family and your mom. God bless you guys, because that's so much. And you grew up there. Like, you were 11 years old when you were still a child going through all that. So it's for them to assume that at 16 or whatever you were capable of just taking it all in. You were still a child.
Right.
But yeah, that's amazing. And I was curious about your mom. Did she go back to working, or, did, like, what happened to her? What is she up to now?
She's working again. She got a job. It's obviously difficult, after taking such a huge break in the middle. But she does have a job again. She's so happy. She loves her career. So I'm glad she's back to working. That's always something that was kind of weighing on me too. I was like hoping she would go back. I was waiting for her to make that decision. Obviously, she still has my little sister to take care of too, but it's a lot easier with me being more capable of taking care of myself after everything that she's taught me. I think most of my strength came from her and her ability to support me through everything. So to see her and, her being happy enough to share every time she gets an interview, or her being excited to get the interview, be like, okay, now I'm going to the second process. Can you help me write my email for this? I like being there for her through the entire process. Every time she's like, when she got her job and now she's working again. So to see all of that is so, so exciting and so amazing. And I wish her the best in her career. And I'm always there for her through everything because of how much she's been there for me. And I'm so happy she's succeeding again in her career and she's really happy with her job. Yeah.
That's awesome.
I love what you shared at ABC, how you shared, I wish I could remember how you said it, something about how she taught you. She did all the research. She was studying and she was looking into things, and she taught you. You said something about how nobody's going to take care of you. You worded it better than I could, but she taught you how to. That's where that desire to advocate for yourself came from. Was for your mom, from your mom.
Yeah, she did a lot of research herself. Like the doctors would throw things at her and she didn't understand any of it. She would go home, research everything by herself, and then teach me in a manner that I would understand because she knew me best. And she said to me like many times that if you need to advocate for yourself, you need to advocate for, it's your body, advocate for yourself, what's best. So she said, if you're not comfortable telling the doctors, tell me and I will tell the doctors. And, it got to a point where I was able to tell the doctors myself, but before that, I was actually really upset. I remember yelling at a doctor one time. We were in the room and the doctor kept trying to ask me what was wrong, but I was still in this state where I was like, I can't talk about things. I don't want to talk about what's going on. And it's really hard. So my mom was trying to talk and he was being so dismissive to my mom. But I think that was like something that really triggered something inside me. I don't know if it's like this protective nature for my mom. Like I love her so much. She supports me through everything and I have to be there for her. But the minute he was talking, like trying to dismiss what my mom said, I yelled at him and I was like, please listen to her. She's telling you exactly how I feel. You will not hear it from me because I'm not going to tell you, but everything that she's telling you is right. And like I said it in a much more negative connotation. I'm saying it more respectful, but I think that really paved the way towards my doctors, especially listening to my mom a lot more. And I realized that no one's like really, people don't put a lot of emphasis on the caregivers, and that's really painful to see. But the way that eventually, they started caring more from my mom's perspective was really important to me. And she taught me to advocate for myself. And she's the reason that I'm here also just talking about things too. The strength to kind of share my story. She's like, I wrote this in a lot of my college applications too, actually, is if you can't pay it back, so pay it forward. And, helping other people, kind of helping patients in their journey, being a support system, or, educating nurses and doctors about what they should do better is always something that I'm really more than happy to do, because I can't pay it back to everyone that supported me in my journey, but I can pay it forward and show that I'm here and I'm ready to support everyone else.
That's beautiful. Nancy.
Yes, hi. So I just want to say that you are so strong and you are so brave for having to go through what you did since 11 years old. And what better advocate could you have than your mom? And you're right. She knows you best. She will always advocate for you. Even if you don't advocate for yourself, she will. And she's a super mom. I think everybody on dialysis needs somebody like that. Not just 11-year-olds, not just 16-year-olds, but somebody else to be there with them, just sort of making sure that they get treated with respect and that they get treated right. Because I feel like, and I read that, in dialysis centers, there's a lot done that shouldn't be done, or there's a lot not done also that should be done. So kudos to your mom for just being such a great advocate for you and for being such a super mom and, you know, giving so selflessly of herself and, you know, her career. So that's amazing.
It's
Well,
truly
she's got a daughter who's taken right after her. Yeah.
Yeah, no, it's amazing too. Like I remember so much, you know, early on the renal diet, you know, I would watch my little sister eat whatever she wanted. And, you know, she's my sister and obviously I wish the best for her, but it was still hard to see like she got to eat whatever she wants. And I'm here with very select portions of things. So my sister and my dad eating their food in whatever manner they're able to because they don't have kidney disease. My mom would only eat what I ate. So she'd make her plate look exactly like mine. And so it was so nice because I felt supported. I didn't ask her to do any of that. And, you know, it's literally just exactly how I could be exactly how she would eat it. Nothing else, nothing more, whatever, you know, it just felt very supported I felt like, I felt to know that she cared that much. And I know obviously that the rest of my family cared for me very much too, but it's just that support system is something that I could never I can't thank her enough for that because it's really what got me through everything that I went through.
Yeah. Caroline.
I want to be like your mom as a mom. So
Yeah.
I love that. And I love the if you can't pay it back, pay it forward. I actually wrote it down. I'm keeping that. I'm stealing that. That's great. That's great. And I just want to say that I think you're going to be a great doctor, and your future patients are very lucky to have you. And the nurses that you work with, that you will work with, are very lucky to have you as their doctor. So you're great.
Thank you so much.
Yeah.
Best of luck.
Thank you.
Yeah.
So I actually have I have a lot of respect for nurses after seeing what I've put mine through. So I will say that. They see everything that, you know, even the doctors don't see. They report it, whatever, but like the nurses see everything. So honestly, I have so much respect for all of you guys and everything that you do for your patients. So thank you so much for everything, truly.
Stephanie.
Yeah, I did want to ask, obviously you want to become a nephrologist after everything that has happened. But I'm sure there's so much more to that too. Is there, you know, something that maybe, you know, most people won't know as to why you want to become a nephrologist besides your diagnosis with lupus?
Well, I think a large portion of it is my own diagnosis, but at the same time, kind of, you know, with the way I've seen healthcare, what I've seen as a patient, there is still a lot that while going through it, I thought could be improved. There's a lot that I wish could be improved, and something that I hope to put forward as someone that wants to be in the healthcare, and someone that wants to be a physician. Those are things that I want to implement. I want to get into making sure that whatever care a patient goes through is proper and isn't as minimizing the stress and minimizing the amount of difficulties that they go through, and it's a smooth process. I went through a lot of ups and downs in terms of my care, and I don't wish that upon anyone. And I'd hope that as a nephrologist, as someone that wants to be a nephrologist in the future, I can fix that and fix the line of issues that kind of arise, because I've not just seen it with me. I've been a lot of friends actually that I've made through this journey that also have kidney disease, and talking to them, it's very similar issues that doctors make, and kind of working to take all of that feedback and fix it, because obviously my diagnosis makes me want to get into this, but at the same time, kind of seeing all of the issues that arose, I really want to fix those and implement better strategies to take care of patients and make them feel like they're more than just the diagnosis, more than just whatever they were diagnosed with. Yeah.
Well, gird up your loins, sister. You don't see them now because we're in our cover-ups, but we do parade around in Xena warrior princess garb from time to time. So. Well, does anybody else have any questions, any comments, any insights, anything you found noteworthy that you wanted to share with Disha?
I have a comment. Disha, thank you so much for sharing your story. You are truly amazing. Your mom is truly amazing. And I really appreciate it. I'm behind the camera, but it kind of brought tears to my eyes to kind of see you tell your story and then talk about your mom. It's awesome. I love it. Thank you so much.
Thank you. Thank you. I really appreciate that.
Yeah, so your challenge, especially as a physician, you get in the machine of healthcare, it's different. You know, it's a business, and like anything else, caring is often an afterthought. So your challenge is to make sure that you always lead with that degree of care.
Absolutely.
It's really important, and it will absolutely make everything else better. And it's funny how we forget that in the business of healthcare. We forget that when we take care of the person in the center, it's always a human being in the center of everything we do. All the other stuff, the mechanics, the finance, the operations of healthcare, they will all get taken care of if we keep our eye on the prize, that prized individual in the center of everything we do in every situation. It will all come out as its best. The other takeaway that I had, you know, listening to you the second time too, is that the power of hope, you know, and our passion here at Specialty Care Management is nurse coaches using a coaching framework. We really strongly believe that every day we can each choose one thing that we can do differently that will make our lives better than it was the day before. I don't care where you are on the spectrum of health, because health or wellness, it's a continuum. It's not like there's one point where you're healthy and the rest of it you're not. There's a continuum, and we're all on that continuum. And every day we can choose, regardless of our situation, one thing that we can do to make tomorrow better than yesterday. And a power of hope. I think that comes through loud and clear in your message as well. Focusing on, you know, the things that are important to you as a person brings hope. What are you excited about? Where are you going? And not just focusing on the doom and gloom of the situation. What you can and can't eat, how you can and can't live your life. What are the things that you're excited about, and how can we help with strategies to help you come as close to that as you can and live your best life? Hope is really powerful. Hope is like fuel in the tank to do the work of self-care. So I think that message comes through as well, loud and clear. Thank you so much, Disha, for just sharing your story, your heart, your talent. And I can't thank you enough for spending time with us. If people have questions, especially, you know, for folks who might be watching, if they have questions or they're moved by your story, or maybe they know somebody who's going through a challenge like that, what resources would you want to point them to, or how could they get in touch with you if you were open to that?
Yeah, I can absolutely, you know, they're more than happy to reach me by email. I'll respond very fast. I can give my email as well. It's Disha, DISHAYADAV, 756@gmail.com. I'm more than happy to answer any questions that you might have at any point. I think it's, you know, having a support system is very, very helpful. You know, if I can be that for you, I'm more than happy to. I'd love to pay it forward, like I've said. But yeah, thank you so much for listening, and thank you all for the work that you do. You may not always realize it, but your words, your presence, and your attitude shape the patient experience in absolutely profound ways. Mm-hmm. I'm here today because of the people that empowered me, and in some cases, in spite of those who didn't. My hope is that you leave here today just, you know, feeling more informed by what I've shared, and kind of also becoming the providers that make patients feel cared for, safe, and just happy. But yeah, thank you so much for having me.
And you can follow her on LinkedIn. She's on LinkedIn. I'm following you. I'm watching you, girl. And
you can follow me on LinkedIn. Also respond on there.
There you go. Well, thank you again. And yeah, keep up the great work.
Yeah, thank you so much.